Welcome back to It's Your Law. I'm George Curtis, and Dr. Klinkhammer is going to tell us about some of the options available today that just weren't there 10, 12 years ago.
Well, first of all, I'd like to start with screening because I think that's probably the most important issue in terms of being aware. I know no one wants to be diagnosed with cancer, but if you can be diagnosed early, it may save your life. And so over the last 10 to 20 years, significant advances have been made in terms of just routine screening. And you've heard of a lot of these things: mammography, prostate cancer screening, colon cancer screening with colonoscopies. Those are the three most common cancers outside of lung cancer. Lung cancer has been harder to screen for, though recently it does appear that a screening CT may provide some benefit, and especially for those who are heavy smokers, that's a reasonable possibility. On top of screening, when treatment is necessary, generally we have a whole collaboration of different professionals that can do different procedures to try to get rid of the cancer if possible and treat the cancer if not. And so that starts with a team, generally with surgeons, with radiation oncologists, with different specialists such as gastroenterologists, urologists. I can keep naming specialties here. And then from a medical oncology perspective, which I'm a medical oncologist, it seems as though every month there's a new drug that comes out for a different cancer. Just in the last year, there's been 3 new advances in prostate cancer. There's been 2 new advances in melanoma, which has been one of the more difficult cancers to treat. In the last 10 years, there's been at least 3 very large breakthroughs in multiple myeloma. And so that is part of the reason that illness is much more easily treated.
Now, we have specialists like you right here in the Valley. So if I fear I have a cancer, I don't have to drive to Chicago.
At times we do recommend, there are certain things that we do recommend that there is travel involved. Though for the most part, medical care can be coordinated locally very easily and without really much by the way of inconvenience to individuals who are diagnosed with cancer.
What are the most common kinds of cancers and their causes, if you might mention them?
So for men, prostate cancer. For women, breast cancer are the 2 most common causes. Lung cancer happens to be the second most common cause, and I would like to put in a plug to try to reduce smoking consumption, as that is the reason for most lung cancer, though we are realizing that a lot of lung cancers are not driven by smoking. And in that situation, there are new treatments available actually that target those types of cancer. Colon cancer is very common, and colon cancer screening can be very effective to try to combat that. But there are books that are this big with different types of cancer, unfortunately.
Well, is the kind of diet we have a factor that affects the number of cancers we have?
There definitely is some data that would suggest that diet is involved. The degree to which the diet is involved is not exactly clear. It does appear that certain diets, especially low fat, basically healthy diets, will likely minimize the risk of developing cancer.
How about obesity, alcohol? We know about cigarettes.
Everything bad would be thought to perhaps increase the risk of cancer, so I would say yes.
I see. Now you've got the people here to make the diagnosis, and you have the team that you've described to treat the cancer. What else is involved to make sure that people don't quit and that they maintain the courage that Dennis has given us an excellent example of, so that they follow through? Without a real strong patient, you're not going to win, are you?
That's a very good point, and there's actually been studies where people who are taking even anti-cancer therapies where they're not compliant or they don't take the medications every day. As we learn more about this, we're coming up with new ways to encourage compliance or just being consistent in terms of medical care. At the facility that I work at, we have a team. We have a cancer coordinator. We have case managers, social workers, nurses, multiple chaplains, multiple support individuals who help support people along the way.
Do you treat the family as well as the individual patient?
We try to. You know, some of these things are going to extend the focus of this talk, and I think that there's some financial implications in terms of trying to address all these things, especially in short visits. Though, in general, I think from an oncologist's point of view, it's very important to include the family in both decision making and in just informed consent, or basically allowing everyone to kind of understand what is going on.
So we have to educate the patient, we have to educate the family, we have to give them hope, we have to have the understanding that they may need additional resources outside the medical resources you have, and I suppose you know where those resources are so you can guide them.
There are actually a lot of very good foundations, institutions. There's the Leukemia, Lymphoma, and Myeloma Foundation. I don't know if Dennis has had a chance to talk with them. I think he has, from what he's told me before. There are, basically, if you name a specific cancer diagnosis, there tends to be a website, a foundation, support group that is available.
Well, and I think the public needs to know that there are Tom Klinkhammers out there, and there are Dennises out there who will help educate you, inspire you, lead you, push you, shove you, saying, don't quit, we're winning the war.
Yeah, I think hope is very important.
All right. Well, you've given us a lot of it, and I thank you for being on the show.
Thank you very much.
And thank you, ladies and gentlemen.